Good day, everyone. My name is Dr. Tiwa, and welcome to another episode of Secondary Podcast. Today, we're going to talk about recognizing the silent signs, the early symptoms of heart failure. Now, your health is your wealth, but sometimes it sends signals that we're too busy to notice. In this way of heart failure does not just happen overnight. It whispers before it roars. Recognizing the early signs can be the difference between life as you know it and a serious health crisis. Heart failure doesn't always start with dramatic symptoms. Instead, it often begins with subtle changes. Things that you can brush off as, oh, I'm just getting older. Oh, I'm feeling maybe this is a busy day. But your body knows when something is not right, and it is very essential for you to listen. One of those symptoms that we need to key into is unexplained fatigue, feeling more tired than usual, even after a good night's sleep. When the heart cannot pump effectively, less oxygen-rich blood reaches your muscles and tissues, leaving you exhausted. It's not just about being tired. It's just about feeling that you've run a marathon, even when you've walked a few steps. Secondly, shortness of breath. Do you find yourself struggling to catch your breath during simple activities like climbing stairs or even lying down? This could be a sign that fluid is building up in your lungs, a hallmark of heart failure. Another symptom you need to look out for, swelling. Do you notice any swelling in your feet, your ankles, your legs? When the heart's pumping action slows, fluid can back up into your tissues, leading to puffiness that doesn't go away with rest. Rings feeling tight, shoes not fitting by the evening. These are clues that your heart might need some help. Again, another symptom, rapid weight gain. A sudden increase in weight, even if your diet hasn't changed, can indicate fluid retention. Gaining 2 or 3 pounds in a day or 5 pounds in a week isn't just a number on the scale. It's a signal for you to take action. Persistent cough or wheezing is another symptom you need to look out for. A lingering cough can produce white or pink tinged mucus, which might be more than just a cold. It can indicate that there is fluid in your lungs caused by a struggling heart. Dizziness or lightheadedness is another thing you need to look out for. You can feel faint, you can feel lightheaded, especially when standing up. It could mean that your heart isn't pumping enough blood effectively to your brain. This is a red flag and not just a passing moment. Why these signs matter is because the heart failure is a progressive condition, but catching it early can slow its course and even improve your quality of life. Ignoring the whispers your body sends can lead to serious complications that are harder to manage. So what should I do, or what should you do if these symptoms sound familiar? Don't wait. Contact your healthcare provider. Simple tests like blood work, imaging, or even an electrocardiogram can provide early answers and lead you on a course to get early treatment that can include lifestyle changes, medications, or other interventions that can make a world of difference. Protect your wealth. Your heart works tirelessly for you. When it whispers, listen. Staying alert to these silent signs of heart failure is an act of self-care and empowerment. Because when your heart thrives, so do you. Nothing is more valuable than that. Your health is your wealth. Invest in it today. And that brings us to the end of another episode of the Secondary Podcast. If you have any questions that you would like for us to know, please reach out to us and we'll be sure to get to them as soon as possible. Until we meet again, I remain your host, Dr. Tiwa. And thank you very much.